It used to be that this was the fringe. There was a 95% of the medical profession that was against it, and only 5% of doctors were out on a limb. Many of them had their own autistic children or a wife with chronic fatigue syndrome. In the last 10 years, that's changed dramatically, and perfectly orthodox general practitioners are moving en masse. The educational programs that they're demanding, their individual practice, is moving en masse towards a better concept of whole person care. The paradox is that as they do that, they're all doing it in private almost. They're all doing it hoping no one notices, and especially that their specialist colleagues don't notice. And the paradoxical response is the specialists are becoming more strident about evidence-based medicine, of not going on false beliefs, of countering that whole movement. And the reason I'm confident about that is people see their GPs. They trust their GPs. They go to specialists only when their GPs tell them. Specialists become believers about 5 years down the line, when they no longer get referrals from the GPs that used to refer them. So we do now have a movement of a medical profession in Australia, initially very slowly, hard to almost notice. Now quite a rush. Now our GP conferences are filled with talks on nutrition and health. They're filled with whole person care. They're filled with a whole different view of the world. In the corner, the pharmaceutical industries and the specialists keep talking as though nothing is going on. But that transformation is happening in the coalface of general practice. And I could name 20 colleagues who would have argued bitterly against any of this 5 years ago, where it is now the dominant part of their practice.